Good afternoon, Niles. Thanks for tuning in this afternoon for Niles Voice of Business. This live stream features interviews with local business owners, professionals, and village representatives to provide resources and insights for the businesses of Niles. Today, we're speaking with Dr. Pamela Lowe, owner of Professional Eye Care Center right here in Niles. Welcome, Dr. Lowe.
Thank you for having me, Alicia. It's always great to talk with you.
Thanks for being here. So, can you share a little bit about the history of Professional Eye Care Center?
Absolutely, absolutely. It's always fun to kind of talk about a business that you've been running a while, so I appreciate the opportunity. Well, I started Professional Eye Care Center in 1992, so 28 years ago now. And it actually was born out of coming out of optometry school in 1988, knowing I wanted to be in private practice because that was where my passion lied. I wanted to have a great place for folks in my community to get excellent eye care. So I was an associate with another doctor. We had an office in Park Ridge and then one out in Carpentersville. And I really thought that was going to be my home. I worked on getting a partnership with him. And then 4 years into it, just realized it wasn't a good fit. Being in business with someone is kind of like a marriage. And so it just wasn't a good fit. We had different philosophies. So in 92, I was looking for a practice and I purchased a Professional Eye Care Center that was originally on Milwaukee Avenue. And I'm proud to say in the neighborhood of Gladstone Park, a half a block south of Superdog. So we would always we're able to get our Superdog fixed. And it was great. I became very embedded in the community, the local schools, and we really did a good job of building the practice with just myself and a handful of staff. And it was in 1,900 square feet. And you know how busy Milwaukee Avenue gets.
Wow,
so we always invest in new technologies and we were just busting out of the space. So that's when in 2007, we decided 15 years into it, we had just outgrown that building, but not outgrown Gladstone Park. We still love all our Gladstone Park patients and colleagues there. And then we moved.
Okay, and you moved into Niles. So
yes.
What brought you here to Niles?
Yeah, so I'm a longtime resident of Niles. In 1995, I moved to the community when I was pregnant with my second son. We were looking for a larger home and just found a great space here in Bunker Hill in Niles. And so I always feel it's important for me as a small business owner to kind of live near where I practice. And when I saw an opportunity for the space in Niles that was 2 blocks from my home, it just was such a great fit. And, coming from busy Milwaukee Avenue, where there really was only street parking, and when it snows, there is no parking. And then the 2 streets that led out to Milwaukee Avenue on my building became one way. And so patients, if they couldn't find a parking spot, they were forced into this weird loop. So I'm at 7225 North Caldwell, right at Toohey, Grosse Pointe, and Caldwell. And I have a standalone 5,400 square feet building with plenty of parking and plenty of space to incorporate all the great technologies we use for early diagnosis.
That's fabulous. Yeah, I love your location right there. It's easy to get to. It's easy to get in and out of. Can you share some specialties that Professional Eye Care has?
Certainly. We really have taken the lead on 3 main areas in eye care. Myopia management, and I don't know if you know, but myopia or being nearsighted is actually epidemic right now. It's projected just in 20 years, half of the world's population will be nearsighted. Now, the problem with that is when you're nearsighted, your eyeball is physically longer in length. And that can cause later in life, 50 and older, health issues that could lead to vision loss, like retinal detachment, cataracts, glaucoma, stretching of the macula. Yeah. And so, practicing for 32 years now, not knowing that nearsightedness was a health issue for my patients later in life, now we identify children early on who are at high risk for becoming nearsighted. So we have a whole part of our practice called myopia management. And that's one of the reasons it's so important to have kids come in, especially if one or both parents are nearsighted. We actually see kids, we see patients from cradle to coffin. So we actually are part of a program called Infancy, where it's a public health program. So for no charge between 6 and 12 months, we will see our babies. And that's when when someone should have their first eye exam, absolutely, in that first year of life. And we're happy to donate our services as that public health initiative because we can find risk factors early on. Now, certainly, many babies don't need glasses, but we can identify what they're at risk for. And if that child is doing well in that first year of life, then we see them at 3. If everything's great at 3, then the continuum of care is 5 years old when they enter school. In fact, it's a law in Illinois that you have to have a comprehensive eye exam for your child before entering school. And then what's great, we can get them on that yearly track and really track these kids to see if their eye is at risk for myopia or nearsightedness. So that's been a part of my practice that just in the past decade has really been an issue and have taken off. The second part is every age group suffers from dry eye. Most of us have bouts where we get that dry, gritty feeling, but it can be very severe for many patients. So we have advanced technologies for diagnosing and treating dry eye that many eye care facilities do not have. And that's a big part of our patient base because at some point in our lives, of us have experienced that. So we're really part of our dry eye initiative. And then for our patients 50 and older, we really have a passion for early management and diagnosis of macular degeneration. Have you heard of macular degeneration, Alicia?
I have not.
Okay, well, most of us either know someone or have heard of our macula, which is the back of the eye, where we're always getting our best vision. That's where we point our eye to see the best. Your macula can just age, and we're all at risk. Time's a risk factor for everyone, but females get macular degeneration at twice the rate of males. And then there's certainly risk factors like if you're diabetic or hypertensive or cardiovascular disease or family history, or too much ultraviolet light, and now we're seeing maybe too much blue violet light, can all be risk factors. And actually, if you have poor nutrition, that's a risk factor too. So we feel that we've done a great job at implementing technologies that can catch macular degeneration up to 3 years before I see it when I look into the patient's eye, or they have 1 letter loss of vision on the chart. So we're really excited about that because we've been catching patients so early. And the cool part about catching macular degeneration early is the treatment is nutritional supplements and an improvement in your diet. No side effects to the treatment.
Wow,
and only a
that's
benefit. Yeah. So we're really excited about being a macular degeneration center of excellence.
Excellent. So my next question, if I've been wearing glasses all my life, I know how often I have to see you, right? I have to see you all the time. I wear glasses. These are just cheaters. They're not for nearsightedness.
They're very stylish, by the way. They are very stylish.
You. So how often should I be seeing an eye doctor? And what about insurance?
Thanks so much for asking that because it is confusing on the continuum of care once we're adults, or like you've always passed the driver's vision test, you've always seen well, and then when we reach that certain point in life, our focusing system goes out. I can't tell you how many times that's the first time many of my patients come in because of that near blur, and they haven't seen any doctors all their life. So it's a great opportunity for us as primary eye care doctors to actually look into the eye and be able to tell them other conditions they may be at risk for. And that's the reason annual eye exams for adults is so very important. The eye is the only organ you can see into without cutting it open, and those tiny blood vessels and the neural tissue, actually the brain tissue we're seeing in the back of the eye, are indicative of what's going on in other parts of your body. And so when we see something failing there, it really points to kind of bigger systemic problems in a patient's body that they can have, let alone vision. And so we say, don't wait till you're blurry to come see an eye doctor. We want to get you before you're blurry and before you have anything that could take your good vision away, so that we can, again, early diagnosis leads to way better clinical outcomes. So every year, it is important.
All right. Okay. Well, I'll be making an appointment. And what about insurance?
Yeah. So, when you're in the eye care space, everyone equates their eye care with just their vision. So do I need glasses and contacts? And there are vision plans for those things. But really, the majority of a comprehensive eye exam is medical. And so a lot of folks don't realize when they have a complaint of headaches or vision blur or changes in their vision or dry eye or eye pain, that's part of your medical insurance. And that's billable to your medical insurance, regardless if you have a vision rider or not. Vision care plans are simply for the glasses and contacts and those benefits. So, don't let the fact that, I don't have vision insurance I hope that doesn't make anyone shy away from getting that comprehensive eye exam, because it's more global. The part of the eye exam where we check, the which is better 1 or 2 and check for your prescription for glasses and contacts, that's the vision care side. But the vast majority of the eye exam is a comprehensive health check of the eye.
Well, that's good to know. Excellent. So even before COVID, we were all spending way too much time in front of screens, right? But that
Absolutely.
time has increased exponentially since March. Are there things we can be doing to help our eyes and ourselves in general during this time?
Absolutely. It has been quite the challenge with, the virtual learning, all our work going virtual, and then the screen time, which was an issue before COVID, as you said, now, becomes a huge issue. So we talked about dry eye. When you're staring at screens or digital devices, you are not blinking as much. You should blink 12 to 15 times in a minute, and that's dramatically reduced to half or a third of the time. So it is important when you're working on your digital devices or computer that you actually think of forcefully blinking. Blinking is your natural tear film clearing that ocular surface, not only to keep your eyes comfortable, but your vision clear. So it's really important to do that. It's important to have workstations where you're not tilting your head or having to struggle to see the screen, because that can lead to ergonomic problems. And it's also really important that the contrast on your screen be really up to par, high contrast. So you want the letters you're reading to be dark against a light background, so they're easy to see, and the size should be large, so comfortable, the large enough size so that it's easy to see those. And we have what's called the rule of 20-20-20, where every 20 minutes you should look 20 feet away or greater for at least 20 seconds. And that'll help break that cycle of the constant staring. And if you're like me, right at my workstation, I keep quality artificial tear. So all those folks out there, ask your eye doctor for a quality tear, because you go into the drugstore and it's confusing for me as an eye doctor. You see these sea of drops and you're like, well, which one's better? You really need to ask your eye care professional which is best for you, because a drop is very different depending on the ingredients in it, and more importantly, the inactive ingredients in it that some of my patients can have allergies to. So very important to ask your eye doctor about the best lubricating drop to use.
Okay.
And one more thing I wanted to add about screen time is, one of the questions I get is blue violet, all that blue violet light coming off the screens. Well, I got to be honest, UV light, ultraviolet light outside, well studied. We know that increases the risk of macular degeneration, damaging the retina, and cataracts. Blue violet, it hasn't been a thing for as long as ultraviolet, and blue violet is necessary. There's actually blue violet light outside that helps our brain know that we're awake. But we don't know the long-term effects of all this digital blue violet right in our face. So studies are being performed on that. And there's, like I said, good blue violet and bad blue violet. So it's really important to know which one needs to be filtered out. And I caution parents, especially on kids, who have these iPhones and digital devices in their hands from the time they're born. We seriously don't know the long-term effects. And what we do know is that too much blue violet causes your brain to think it's daytime and will throw off sleep patterns. So especially in children, where getting that 8+ hours of sleep is so important for brain and health development, that really parents are limiting that time. Because if kids are staring at those phones and devices before bed, it'll throw off their quantity and quality of sleep.
Oh, wow. Okay. Good points. So Professional Eye Care Center is an essential business, and so you have been open throughout all of our stay-at-home orders, correct?
Correct. Mhm.
And so what are the extra precautions you are taking to keep both your staff and your customers safe?
Well, I do have to share when all this happened, and it was March 17th. That'll be a day that lives in infamy at our practice. You know, we are considered, as you said, essential workers, so we shut down to urgent care only. And my first bubble thought wasn't, oh, are we going to run out of toilet paper? My first bubble thought was, how do I keep the staff safe, because we have to be there to take great care of our patients. And so we locked down where our doors are locked, and they're still locked to this day. We had locked down, and at that time we were only seeing urgent care either by telehealth, which is a safe way to see a patient. But in the eye care world, you know, that's a small sector of patients that you could diagnose over the computer. So that's how we were safely taking care of our urgent care patients. Obviously, health questionnaire before they came in, seeing them quickly in the office. Our office every month gets an aeration of a chemical that has a nano surface. It's called MicroSure, and it actually coats all the surfaces for 30 plus days so that no viruses can stick. So we still clean in between, but it's just that extra layer that if somebody were to, you know, put some type of virus transmission on any of our surfaces, the chances of transmission is much less. I do have to say, from all the studies and what we do know about COVID, fomite, or getting a virus from a surface, is a smaller percentage of transmitting, especially COVID, that way than compared to the air. So that's why we've been wearing masks for sure. Every patient who enters the office, of course, wears a mask, but we take an extra layer where we sanitize the hands, and then we've been using gloves, mostly just to make patients aware of, oh, I shouldn't be touching things myself or things around them. And we find that that's really been helpful, and it gives our patients a nice sense of security.
There you go. Best way to get an appointment with you, call this number?
Best way to get an appointment is call the number, or you can email at info@proeyecarecenter.com. With the parking lot being our waiting room, sometimes you will have to leave a message because everyone who enters the building has to call first. So please just leave a message, and my team is great at getting back to everyone as soon as possible, and we can get you scheduled in. And this is the crunch time of year with all the health savings that patients have to use or lose with their benefits. So we encourage you, if you need to get in, you can use all those savings that you get that you've already put aside that are tax-free for your eye care.
Excellent. So we like to finish our interviews with something about Niles. We like to ask our business owners where their favorite place to eat or do carry out from in Niles is.
One favorite? Come on, we're talking food.
You can give me more than one. Okay.
Okay, good. Well, I'm actually standing right now in my home office. I came from the practice, and I'm in my home space. And I actually own the house that Mama Riggio built. So talk about Niles history. So
wow.
Riggio was one of my favorite places, but we know Riggio's is gone now. But we enjoy a lot of the eateries in Niles. My practice is right next to Wildwood Tavern, so we love our neighbors for some great barbecue. Love Graziano's. They're down the street and always do a great job. Howard Street Inn when I'm golfing. Love to run in there and get a nice treat. So fortunately in Niles we have a lot of great places to go to.
We do. Dr. Lowe, thanks for taking the time to educate us today on our eyes, and we'll be seeing you soon.
Thank you so much, Alicia, and thanks for the great job you do. You kept all of us feeling that we're still part of this craziness, and you've kept us so informed. So thank you for all the great work you've done for the Chamber.
Thank you. You have a great day.
You too. Take care.
Bye-bye.